really ask the questions and learn from them, what is it that's going to improve your quality of life, not just demanding particular procedures.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Daniel Yamini here, and he is a double board certified plastic surgeon in private practice in Los Angeles for the last 21 years. He's a graduate of Stanford University and UCLA, among other institutions. He's an expert in complicated cosmetic and corrective breast and body contouring surgery, and is often referred to patients to repair previous unsatisfactory plastic surgery. Dr. Yamini is most passionate about what he calls functional and holistic plastic surgery, which he describes as plastic surgery to make patients feel better and function better, something quite different than traditional cosmetic surgery. So Dr. Yamini, glad to have you on here and welcome.
Hey, thank you, Daniel. Appreciate it. Looking forward to the podcast.
Yes, let's dive right into it. How did you get interested in aesthetics in the first place?
Well, like I said, when I went to college, I wanted to be an engineer. Stanford was very big on that. And I sucked at math and physics. So I quickly learned that, okay, the greatest piece of machinery I'm going to master is the human body. So I went into biology and psychology, because you need to know the biology, you need to know the psychology to really master this marvel of engineering, which is the human body. So with that, I went to medical school, and I actually thought I was going to be a psychiatrist, and I immediately disliked the actual field of psychiatry, but fell in love with surgery. The moment I saw my first incision, I had an epiphany. So I fell in love with surgery. And after 5 or 6 years of surgery training, where we do all sorts of rotations, I realized that plastic surgery was the most fascinating and the most widely interesting sort of discipline for me, because you get to operate over the entire body, over all the organs, and you can really make the most dramatic change. So now I joke with my patients that I'm a psychiatrist with a knife. And I basically do what I love the most, which is the engineering, but for the human body. So that's the long story to how I ended up in plastic surgery. Specifically, over the last 20 years, we all train to make people more beautiful, make our patients prettier, nicer, whatever way. And that's very rewarding. It can be life-changing. But over the last 2 decades, I've learned that for me, improving the quality of life, or how people function in all the different ways, that's been the most passionate, rewarding thing for me. So now I'm very interested in transitioning from just cosmetics to what I call a holistic, functional approach, using my skills and knowledge to really improve the quality of people's lives, whether it's pain, whether it's congenital deformities, whether their body's just lost a lot of its function for whatever reason. So that's been my passion now.
Got it. Now, this actually is a great segue into my next question. Is I want to talk about really what differentiates you from others in the industry. And I really want to dive deeper into this health and functional issues that you're talking about, because I think when most people think about plastic surgery, they're always thinking cosmetic. Oh, it's to fix my nose, or to have to change something physically, cosmetically. But you're talking it from a holistic, functional side of it. So can you talk a little bit more about that?
Yeah, you're absolutely right. Most people believe that plastic surgery is just for women, rich upscale women who want to look more beautiful. It's vanity. But that's really far from the truth. The origins of plastic surgery started after World War II, where all these soldiers, and you needed to create the science and the surgical skills to make these unfortunate people whole. All their functions that were damaged from battlefield scars, you had to repair it. And then treatments for cancers and all these congenital things. So plastic surgery really evolved not about cosmetics, but about making people look normal and have normal function. And that's a part of plastic surgery that's still being taught. And in fact, a lot of the plastic surgery performed worldwide is still for what we call full function. It's not for beauty, especially for young kids or older people, people with cancers, people with injuries. For some reason, the media really picks up on the cosmetic because it's just more sexy and flashy. So I was trained in both reconstructive cancer treatments. I trained under a very famous, a late craniofacial surgeon, Dr. Jackson, who worked with congenital deformities of the very young, newborns, babies, small children. So I really learned from a very young age this incredible skill and power we have to people of all ages, of all backgrounds, really look and function like normal people. So they're not disfigured. So they can talk, they can swallow, they don't have deformities. And to me, it's most rewarding with the youngest population. Most of our training nowadays in plastics tends to be in cosmetic. So I think what makes me different is I really go out of my way to try to understand how can I make someone's quality of life better, and not really focus on just necessarily making them more beautiful for a period of time. That's fine, but now that I've been doing this for 20 years, I'm really focusing on people who, for example, they've had multiple pregnancies and their core muscles are dysfunctional and they have back pain. Women who have congenital deformities, who have very heavy breasts, they have neck pain, headache, they can't function, okay? So not only do they look better, but their performance at home, at gym, with their kids, at work, and their personal lives improves. Their confidence improves, their self-esteem improves. So that's really what I think is the difference between myself and most surgeons is a mindset, a focus on what we choose to treat.
Got it. Now, I'm sure when it comes to the patients that come and see you, there's some education that has to go into it. So how do you educating your patients about what you offer and the benefits? Particularly, I'm sure some come to you with thinking, oh, it's more cosmetic than functional. So could you talk a little bit more about how you approach educating your patients in that?
Yeah. Most of our patients are word of mouth. Years. We have so many loyal, happy, satisfied clients that they hear about how I approach patients, their problems, and how I'm focused on safety, conservative, and doing just the right amount of surgery to help their quality of life. So a lot of these patients come to me with that mindset already. But when they come to me, I really ask all the right questions about what is the real problem? Why are you here for breast surgery? It's not just about beauty, for example. If you ask the right questions, you'll find out that they're losing function. They can't do yoga anymore. They can't do Pilates anymore. They can't dance anymore. So I steer them towards treatments that are not just purely cosmetic. In fact, I've been removing more breast implants in the last few years than I've been putting in. And I have found that by really asking the right questions, listening to what will make the quality of life better for them, then you can really customize the treatments. And that's where really the education comes in. And many of my patients tell me, oh, wow, Dr. Yamini, I've been on consults. I had no idea these were the options. I had no idea I could feel better about my body, my breast without implants or without this major surgery. So that's a type of education I do. And maybe it's a little bit of the skills I learned from psychology major. It's really not just looking at the patient, listening to what their feelings are.
Got it. Now, I'm sure when people come to you, they have certain misconceptions about really what you do, what the treatment can really do for them. So what would you say are some common misconceptions that you hear a lot from your clients when they come to you looking for your help?
Again, the biggest issues patients are struggling with is they think that plastic surgery is just for the elite or the very vain people who want to look fake. So the biggest concern patients have is, oh, I don't want to look fake, but I'm not happy. I'm really dissatisfied. I don't have self-esteem or confidence. It's affecting my personal life, my relationship, my work, etc. So that's a big misconception. And I have to educate them that, hey, my job is not to make you look like a movie star or someone who looks different. I just want you to feel your best and look your natural, authentic self in your own body, not like a different person. Just take away the problems, the physical problems that are having all these effects on you. So that's a big misconception. Other misconceptions patients have is that, oh, all surgeons are the same. But that's not true. You got to find someone who I think has my mindset of really listening and caring for exactly what's going to make the patient happy. This is not cookie cutter where everybody has to have big breast implants or everybody has to have bigger, like a Instagram or social media star. No, most qualified, good, caring plastic surgeons care about doing the right thing for the patient. So that's another misconception patients have. And the fact this requires very complicated, dangerous, dramatic surgery. I really have to educate them that we can do a lot of really nice, helpful procedures that will improve your quality of life without big scars, without months of downtime. So those are the biggest misconceptions patients have.
Got it. Thank you for sharing that. Now, I want to ask you about maybe some new or emerging treatments or technologies that you're particularly excited about. I know we're talking a little bit about the non-invasive energy-based technology and also regenerative therapies. So could you talk a little bit about those?
Sure. Technology has always played a big part in surgery, all aspects of surgery, especially in plastics. We, as a scientific group of people, we love to focus on doing the least invasive, causing the least amount of damage and getting the most benefit. So over the last 40 years, the technological manufacturers have really spent a lot of time and money and research trying to create machines or technology that will help us with that. All of these technologies really fall into the categories either firing high energy of heat or cold to manipulate the tissues. And anytime you want to drive heat, you're using lasers or ultrasounds, radio frequency. These are all different energy-based devices, and there's a lot of new technologies that are now safely being used in that arena. What I'm most excited about, what we call electroceuticals, or high energy, high focused electromagnetic energy. Basically, this is devising machines with protocols and algorithms that analyzes the body and delivers the right amount of electricity in the right way to the right body parts. And my favorite machine in many, many years is the M-Sculpt Neo. It's called electromagnetic sculpt. That's how they came up with the name, by BTL, which is a European company. And they've put a lot of effort into creating these machines that fire focused electromagnetic energy to strengthen and enlarge muscles. This by itself is not new. Chiropractors and rehab docs have been working with this for many years, but this manufacturer has taken this art form to the level where you can target all the core muscles, for example, or arms, or the gluteal muscles, or the big muscles of the leg, and figured out the algorithms of how to pump the right energy to enhance muscle strength, muscle metabolism. And the latest generation of these devices also add radio frequency heat, which targets fat loss. And this fat loss, we call it apoptosis, which is programmed cell death. These energy devices essentially program the cell to die over a period of time. And as you burn calories, use your muscles, it targets where those fat cells die. So unlike diet and exercise, where you kind of lose fat throughout the body, this technology really allows you to target, okay, let's lose fat in your midsection or your love handles. Or the greatest research that I've seen recently is targeting visceral fat. That is the very stubborn fat inside the belly around our organs that makes the belly stick out. That is a target that causes cancers, stroke, heart disease. So I think we're on the verge that where we can fine-tune this technology to target programmed fat loss in our internal organs. I don't think we're fully there yet, but we have very strong clinical evidence, prospective studies show we can target that. So this electroceuticals is an area that I'm very excited about. You also mentioned regenerative technology. I think that's very huge, and that's a huge discipline in and of itself, which is the science of tapping into our existing healing and recovery genetics, or the molecules, the signaling molecules in our body that signal our body to heal, recover, grow stronger. So with the advent now peptides, which is really exploding in our field, stem cells, exosomes, all these signaling molecules, there's a tremendous amount of science there that I think in the next few years, not just plastic surgeons, but all physicians can tap into to help our patients recover from all sorts of ailments and illnesses. And it can really affect our function, the quality of life, and even the cosmetics. So those are the two big areas that I'm most excited about. And obviously, like all the different industries, not just medicine, I think AI will have a huge impact in studying all the clinical cases. I think big companies, big data companies are going to be aggregating major amount of data about our healthcare and lifestyles, and they're going to be coming up with algorithms where in the very near future, we're going to have apps that tell individuals what kind of lifestyle changes to make for particular healthcare problems, which again will affect the quality of life and how we look. Yeah. So those are some broad areas that I'm very excited about to see technology developing in plastic surgery.
Okay, Dr. Yamini, you were talking about some of these new treatments that you're really excited about. And so I want you to talk a little bit more about Renuvion, because I know it's something that you're really excited about. So could you talk a little bit more about that?
Thanks for bringing that up. Yeah, under the category of electroceuticals, all these fancy devices that manufacturers make that use electric power to manipulate our tissues. This technology has been around for probably 5 years or so in mainstream. It actually was created by one of the oldest manufacturers, the Bovi company, that revolutionized electrocautery, old-fashioned electrocautery that's been used for decades all over the world. Well, they sold the rights to that company, and they focused all their research on a new generation of devices that helps literally tighten up the tissues. In the field of cosmetics and plastics, we always worry about when we manipulate the body parts, it can get loose and saggy. So how do we tighten things up? Radio frequency is one of the solutions. We have machines of radio frequency that we use on the outside, like the Morpheus is very popular. But on the inside of the body, the Renuvion manufacturers created this, essentially it's a long needle, and it fires an electric current. It's essentially like a wand with lightning at the end, and it sprays a helium gas, and you create this tiny little focused helium blowtorch, essentially. That's very safe and effective to target body parts, especially during liposuction. So after we remove the fat, for example, we use the Renuvion technology, and we can use it all over the body to heat up the tissues, and it helps coagulate and tighten up all the layers between the skin and the muscles and near the bones, so that the tissue doesn't get loose and it doesn't fall. So now that's really helped take our results with liposuction and body sculpting, and I'm very excited to use that all sorts of plastic surgery now.
Now, you did mention weight loss, so I want to get your thoughts on really Ozempic, because it's been this really big name that really came out there, and semaglutide, and how that really ties in with plastic surgery.
Yes, as your audience knows, the GLP-1 agonists, which are hormones or signaling molecules in our internal organs, in the GI tract, in particular the pancreas, they have tremendous powerful effects on our stomach, on our appetite, our eating, our digestion. And they've been studying this for well over a decade, but really in the last 5 years, these categories of medications, Ozempic was the big blockbuster. Now there's Wegovy and Mounjaro, and they're evolving dozens of other ones. what we're seeing is they're having very powerful effect on our eating lifestyle, how we handle food and appetite, how our digestion actually works. And sometimes these medications are even too powerful. So I caution our patients to, if they really need weight loss for health reasons, not just cosmetic, those are two separate categories, to go see a qualified doctor, get the real medication, not the fake ones. Make sure it's a quality source. Use the smallest dose possible so that you don't go into what I call starvation mode. So one of the plastic or cosmetic surgeon is starvation mode weight loss medication. You literally don't want to eat. So you get malnourished. Obviously, you're going to lose a lot of weight. And some of it is fat loss, but a lot of that, up to a third of that weight loss, is other essential bones and muscles and tendons. Okay. So we have to be very cautious how we advise our patients to handle these very powerful weight loss drugs. Again, it should mainly be used for people who need weight loss for health reasons such as diabetes, heart disease, high risk factors, stroke, cancer, sleep apnea, blood pressure, all of these reasons. I'm a big proponent of carefully using low to moderate doses. I don't believe it's a good use for cosmetic patients. It's not going to replace traditional body sculpting. Because if you're using this fat using starvation mode, you don't control where you lose. Maybe you'll shrink a little bit and it's fine, but then what we see is that the face starts getting hollow. Various body parts, you lose a lot of this elasticity in your skin. So the tissues start falling. Even the fingers, we've seen weight loss, deformities of the fingers. So the whole body goes into a starvation mode and it's almost a malnourished appearance. So that's why these weight loss medications, the new generation, because they're so powerful, they're starting to come other cosmetics. So I always caution patients to be very careful and go to the right specialist if they want to look better using these medications and they don't have real health conditions.
Okay, got it. Now, I'm sure you, throughout your career, Dr. Yamini, you've seen some particularly challenging cases that have come your way. Would you mind sharing maybe just one story about a really challenging case that you came across and how you were able to get them a successful outcome out of it?
Yeah. I do have one case where I handled, I think about 5 years ago, which was one of a kind, rare case, but it was very dramatic. Physician from Nevada who knew I did a lot of complicated breast surgery referred a client to me and said, look, Dan, this patient has seen all sorts of doctors. She's having a lot of symptoms, GI symptoms, swallowing problems, breathing problems. She's lost her energy. She gets nauseous all the time. And I'm like, well, they need to go to a gastroenterologist. They said, no, it's related to her chest. The cardiac, the thoracic doctors who operate on the chest have told her that her chest is caved in, her rib cage has collapsed because she's very lean, and literally her chest was pushing back against the spine and squeezing the blood flow and crushing some of the windpipes and crushing the esophagus. So her heart function, the blood flow function, the swallowing function was really affected. The nervous system that goes along the spine right in the chest was affected. And when I went there, I saw these very large breast implants. And when she laid down, she would have symptoms. And it finally dawned on me that, wait a second, these implants are so heavy. They're literally like weights crushing this very thin woman for years and years and years. And when I took the pressure off by literally changing her position, her symptoms would go away. So I said, look, I don't think you need to have it opened up. You don't need to have open chest surgery and have all this hardware, screws and plates put in to move your rib cage. That's going to be a horribly major surgery with big recovery. let's just remove your implants and let's do a very moderate amount of cosmetic work so that, yes, you will look kind of flat, but at least you won't look deformed. You'll look like you have very small breasts. And her husband were at their wits' end, and they said, okay, this is way better than having open chest surgery. So we did that, and literally immediately, she had a very quick recovery, and she got very decent, I would say, reasonable cosmetic results. And she healed within a few weeks, and she went back to Nevada, and next thing I know, she's sending me pictures of her playing golf. She said, I haven't been able to play golf in like 10 years. I couldn't even walk up and down a golf course. I couldn't run around with my kids. So to me, that is one of the best rewarding cases I've had of improving the quality of life for a woman using the skills of the plastic surgeon and allowing her to avoid really essentially open chest, similar to open heart surgery, which would be very ugly scars and very painful and totally unnecessary. So, and there's a host of similar cases, yoga instructors, people who have lost their function of their chest and upper body because of the complications of even decent plastic surgery, not bad surgery. So I've learned to look out for individuals who are suffering from even normal plastic surgery and to explain to them and teach them, hey, you can feel better without all the usual cosmetic result. Mm-hmm. So that's been very rewarding and the direction that I want to take the rest of my career in.
Yeah, I mean, that's a fantastic story. I mean, changing people's lives. I think a lot of people don't really think too much about that when it comes to plastic surgery. They just think, oh, it's just to make you look better or look more vain, but they don't realize how much it really affects people and changes their lives. So I think that's a fantastic story. Now, Dr. Yamini, where do you think the future of aesthetics is going, particularly with the integrated and the holistic approach? Do you think that's going to be catching on more and more?
Yeah. I do believe that evolution of the surgeries we're doing all over the body, whether it's cosmetic face or eyes or nose, lips, breast, your midsection, we've really pushed that to the limits of the art and science of plastic surgery. Most of the techniques we have been around for 30, 40, maybe 50 years. Okay, so now we have to learn to integrate other disciplines, anti-aging, regenerative medicine, these electroceuticals, to be a qualified expert plastic surgeon that can really help patients beyond just the routine cosmetics we do. We have to get educated in all the different aspects that we talked about, helping them with their weight loss, helping them with their hormones, helping them with stem cells, regenerative medicine, with the right skincare, using the proper non-invasives. In fact, the last 3 years, I've become a member of the American Academy of Anti-Aging Regenerative Medicine. It's totally non-surgical. And there's OBGYNs, cardiologists, internists, rheumatologists, infectious disease doctors. And I'm taking lectures just with them so I can help my patients learn about other integrated disciplines of medicine where a group of doctors can all focus on the health and function and the quality of life of the same person. Right now, most plastic surgeons, we have a certain number of tools in our toolbox. I have procedure X, Y, and Z, and that's what I'm going to offer you. That's how I make my living. And I think that's very antiquated, old-fashioned technique. I think the way of the future, and this is a goal of mine, a passion of mine, and I'm always looking for similar-minded professionals to partner up with me, is how do we get people in, for example, GI medicine, people, biochemists in regenerative or anti-aging, biohackers. How can we work as a team to, for example, reduce the inflammation in a patient so that their belly shrinks, so that they're not getting unnecessary tummy tucks? Mm-hmm. I can easily say half of my patients who come in, they don't like their midsection. Mm-hmm. They're not surgery candidates. Mm-hmm. What they really need is proper assessments of their GI tract their hormones, their stress response, their cortisol. They need to be on the right anti-aging or regenerative supplements, anti-inflammation, systemic inflammation medication. There are really dozens of different biochemical pathways that we can help patients with that are completely non-surgical, that can help the patient look and feel better and have a better quality of life. So that's why I like to use the word holistic plastic surgery. The word holistic is being used in every industry now, but I do believe that that's going to evolve to a big extent in plastic surgery, especially when you integrate it with other specialists in medicine. So that, to me, that's the most exciting part of what plastic surgeons can learn and offer in the future.
Got it. Great. Now, I have one last question for you, Dr. Yamini, but before I ask it, I want to point people to your website at www.sunsetcosmeticsurgery.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's maybe on the fence about going and seeing a plastic surgeon for a health or functional issue, but something is holding them back? What kind of advice would you give to someone like that?
Yeah, that's an excellent question. We face this issue all the time. Number one, do your homework, whether it's online or talking to your friends, family, peers who have had experience with a physician. Make sure you go to a board-certified plastic surgeon, okay? And there are websites for that, the ASAPS, ASPS, but in general, it means that this doctor is actually trained in plastic surgery and they've passed all the very rigorous credentialing necessary to be board certified in plastic surgery versus cosmetic surgery, which are, they're very qualified cosmetic surgeons, but they're not trained in plastic surgery. And more importantly, once you decide, okay, well, who's my plastic surgeon? Do they have the right experience? Make sure you go in with an open mind. Don't go in and say, hey, this is what I want. Plastic surgeons, they're not like a mechanic or electrician where you say, hey, do this for me. Really ask the questions and learn from them. What is it that's going to improve your quality of life? Not just demanding particular procedures, because there are many ways to skin a cat. Again, the example of someone who doesn't like their midsection. Well, you don't always need a tummy tuck. In fact, that can make your life a lot worse. You will have big surgery, unnecessary cuts. You won't look good. So really be careful of what you're asking for. Go in with an open mind and really make sure you relay to the board certified surgeon, hey, this is my goal. What is the safe, healthiest way for me to achieve this? And just be open to the fact that lifestyle changes might be your best option. The most honest option might be, hey, diet, exercise, good sleep, good hydration. That might be all you need rather than very major surgery. So that's my major advice for patients who are seeking cosmetic surgeons or plastic surgeons.
Okay, well, there you have it. Dr. Yamini sharing his expertise. Now, Dr. Yamini, where can people contact you and your practice?
Our website is sunsetcosmeticsurgery, all one word.com, 310-858-9100, or Dr. Dan Yamini on Instagram.
Okay, perfect. Well, thanks for being on the show, Dr. Yamini, and sharing your message.
I appreciate it. I enjoyed it, Daniel.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.